Good afternoon, everyone. This is Anna Ricklin with the American Planning Association, Planning and Community Health Center, and we're here for our last session of our 6th webinar series on Planners for Health. This session is about sustaining the momentum of the movement and how to keep everyone engaged, as well as to learn some new ideas and tricks for doing so. We're going to start off, as we have all of our webinars, with an overview with our folks who are facilitating from the Prevention Institute, Rachel Bennett, Associate Program Manager, and Sandra Vera, also Associate Program Manager. If you have any questions as we walk through the webinar, please chat them into the chat box so that we can be sure to answer them during our 2 Q&A periods at the end of the presentation. So for now, I will pass it over to Rachel and Sandra to kick us off.
Thank you, Anna. Good afternoon, everyone. This is Rachel Bennett.
And Sandra Vera.
And we are so happy to be with you on this Wednesday in what is now firmly midsummer. I hope summer is going well for everyone so far and you're finding ways to stay cool and have fun wherever you are. As Anna mentioned, this is the final webinar in the Planners for Health series, and Sandra and I just wanted to start by taking a moment to thank APA for the opportunity to include Prevention Institute in the Planners for Health initiative, excuse me, and to thank all of you for your participation in the 5 webinars we've had so far, and in advance for your participation today. I think this has been a really tremendous learning experience for us, and we've been so pleased to be able to facilitate this learning community and get to meet so many of you. So thank you, starting off with that word of gratitude. So today we're going to be talking about sustainability and looking ahead to what comes next, both after the Planners for Health initiative, but more broadly speaking, thinking about how to sustain the healthy planning movement beyond any one funding opportunity or project, which is, I think, a subject all of us can relate to. So what we wanted to start off with was putting out the idea that sustainability of healthy planning work, of any project or any initiative, is about more than just money. We're going to talk about financial resources because obviously that's critical to our work. But we really wanted to take a moment to talk through how everything that we've talked about so far in the Planners for Health series is about building a drumbeat, building momentum for an approach, and creating new norms in our field, and that is a way of sustaining our work. So we have talked over the last 5 months about a number of different facets of healthy planning work. We talked about assessing the landscape. We talked about building partnerships. We talked about how to really meaningfully engage your community stakeholders. Talked about communications and framing and making the case to funders and decision makers. And one thread that we've tried to weave through all of this is that how we do this work is just as important as what our outcomes are. So as we talked about in webinar number 3, for those who were on it, that focused on health equity, it's really as much about embedding an approach in the process as the particular outcomes we achieve in any one project or initiative. So that when we get to our outcomes, when we have a pedestrian master plan, when we complete a street, when we establish a new farmer's market or develop new affordable housing with protections against displacement, for example, we're also simultaneously building leadership in the community and among youth that's going to outlast any one initiative. We are establishing and understanding that community conditions influence health, and we're bolstering a commitment to further improving those community conditions. And one of the really important themes we're going to talk about today is that partners outside of traditional health and planning are seeing their own roles in this work, whether that's educators, builders and developers, public works, parents, any number of different stakeholders have a vested interest. So like I said, a key component of sustainability is really about changing the norms, changing the way we do business in our fields, and that is really what we're going to talk some more about today and what we want to hear about from you.
this idea that sustainability is about changing norms, building practices is exactly what we've been talking about, for the last 5 webinars, so it's not new. We did want to share a bit of a description of sustainability that may be helpful for you and your partners and collaborative moving forward, which I think does a good job of sort of, capturing what Rachel mentioned, which is sustainability is really a community's ongoing capacity and resolve to work together to establish, advance, and maintain effective strategies that continuously improve health and quality of life for all. So even though, inevitably we come to the question and we get asked, in fact, in grant applications or requests for proposals, how will this effort or initiative be sustained after the funding period? We can think about new funding or different funding and leveraging other funding opportunities, which is one element of that, but there are several to be thinking about. So we've captured a few of the ones that Rachel has mentioned and that we've talked about over the course of the last 6 months, which include engaging and supporting leadership building in the community, increasing capacity around policy systems, environmental change, building those multi-sector, multi-field partnerships, and being able to make the case to decision makers and funders about the ongoing value of the work. Last month, we talked to Berkeley Media Studies Group about effective communications and messaging, and all of that helps to kind of thread together these pieces. So we'll just take a few moments to highlight some of the ways that we've seen sort of the case made to decision makers, including policy makers, elected officials, community stakeholders and leaders and funders, about the value of this work. For Prevention Institute, for example, we really had to land on the fact that for us, community prevention is about health equity and social justice, and there's other facets to community prevention that we should share with elected, appointed officials, with business partners in the community, et cetera, including that community prevention saves lives and money, makes economic sense, emphasizes local solutions, emphasizes the value of collaboration and partnership, and addresses multiple community priorities. So those are the elements that we come back to time and time again, and that we've also seen successfully take place and take root across the nation. So let's highlight just a couple of ways in which that has come up in different areas. So community prevention saves lives and money too. This is about, I think a big public health goal around making sure that we are saving lives and improving quality of life. And that's incredibly important and an effective strategy for all of the stakeholders that we discussed. But we also need to draw in the fact that community prevention can save money as well, and that funding community prevention is a smart investment that will pay off for building health, preventing people from getting sick and injured in the first place. So we have to address this in order to really think about our economic viability more holistically. Mayor Chip Johnson from Hernando, Mississippi talked about, if people in our community are ready to be healthy and want to go run at the track or walk on the sidewalk but don't have the infrastructure, we have not made it accessible. The role of the city is to make health accessible through infrastructure and investments in the places and spaces where people can be healthy. From Mayor Mick, many of you may know him from his work in Oklahoma City, really thinking about community prevention and infrastructure as a way to draw in business and to enhance the business community in Oklahoma City. So no business wants to locate to a community with bad health. They'd wonder about absenteeism rates and healthcare costs, but if we are truly going to be a job creator and are looking to keep healthcare costs down, you have to be a community where health is a priority. So again, this is, drawn from public health and planning roots, but this is, these are elected officials really talking about why this matters for a number of different sectors and partners. So we encourage you to find those messages and those quotes that could really advance your own work. And this is something that really lends itself, across the metaphorical aisle, that this is an opportunity from stakeholders and decision makers and policy makers with different perspectives to sort of say that they found that investing in health and prevention not only helps their friends and neighbors' quality of life, but it also gives our limited budgets the most bang for their buck. And this is coming from a joint statement, an article from, again, Mayor Chip Johnson, but also from Mayor John Reardon around talking about health investment for cities. So important ways to really move the conversation forward. And what we've been talking about, throughout this time together is that prevention, community prevention is local. It's about local solutions and partners coming together. And what we've seen happen in the case of like Maryland and other communities that are part of the Great Allegheny Passage, which is a 141-mile system of biking and hiking trails, is that it's important to show how these efforts really contribute to different facets of the community. In this case, there was an economic impact study on the passage, which showed that there was an estimated 800,000 trips taken annually on that trail system, and they were able to attribute some economic impact data. Annual direct spending attributed to trail users was $40.8 million in 2008, up from $7.26 million in 2002. Total annual wages attributed to trail user spending, $7.5 million, and business owners attributed a quarter of their revenues to the proximity of the trail. So really drawing on the community context, local values and priorities, and showing impact data and opportunity helps to create a strategy that engages different types of partners and allows sort of this approach to be sustained in ways that are locally relevant over the long term. Again, we'll come back to some of the specifics around funding mechanisms and opportunities, but we wanted to really open up this conversation and overview to an expert and colleague partner of Prevention Institute, Shaniqua Owusu, who is a program director at Change Lab Solutions, where she works at the intersection of community development and health. She leads a multidisciplinary team that supports localities and organizations across the country and helps them to create healthier communities. Previously, Shaniqua served as a director of strategic partnerships and community engagement for the New York Academy of Medicine, where she led community development and participatory planning initiatives and oversaw government relations. There's a lot that we can learn about Shaniqua, and we hope to do so in the coming moments, and we'll also open up questions for her and Prevention Institute. So at this time, I will invite Shaniqua to join us in this conversation. Welcome, Shaniqua.
Thank you so much. On behalf of Change Lab Solutions, we thank the American Planning Association and the Prevention Institute for inviting us to be a part of this exciting and important conversation. I will tell you first a little bit about Change Lab Solutions. So our vision, this kind of just depicts our vision of what a healthy community is, and I'm pretty sure we all share this vision. Our mission is to create healthier communities through better laws and policies. We support communities in developing and implementing legal and policy solutions in support of a culture of health. And we believe that laws and policies, as well as direct engagement with communities, are the foundation for health equity and the broader and the Healthy Communities movement. So what I'm going to do today is walk you through, tell you a story about a neighborhood in New York City, and then focus on two specific strategies that can support sustainability. But I want to start with this really great quote from Michael Oser from Riverside County's Health Department, because I think it encapsulates what's on top of mind for everyone. And, you know, let's face it and be honest, the lack of resources is often the first excuse or barrier that people give for not trying a new approach. And that's why this quote is so exciting. So he says, nobody has money. We have people and resources, not money. But we can help them do a health fair. We bring those resources, and then we would work our way up. We have to have a big view and realized that while there's no money to do this, there are a lot of groups that are doing similar work. If we all work together, you can actually make it all work. So, you know, key to sustainability is not just the financial resources, but it's leveraging the expertise, the talents, the will of people based in the community, in local agencies, and taking that collective willpower and dreaming of something big and then working to achieve it. So you may have seen this already. Plan4Health has a sustainability checklist organized in 4 domains: champions, communications, diversifying funding, organizational structure. And each of these domains talk back to a number of the previous webinars that some of you have participated in. And what I'm going to do today is talk to you about East Harlem, New York, through the point of view of a champion. So let me tell you a little bit just to set the context. East Harlem has a median income of $31,000. 32% of people live under the poverty level. It's got a high unemployment rate. It's got the 2nd highest density of public housing in the country, and it's got huge health disparities, including children and adults have a high rate of hospitalizations due to asthma. And so the picture you see to the right is Melissa Mark Viverito, and she is the council member for this district, and in present day also is the Speaker of the New York City Council, the 2nd most powerful person in the city. And she became the champion for her district. She knew that she was going to be focused on health because she heard loud and clear that this is what her constituents wanted and needed. She looked at the data. She started to connect with partners in the community, and she realized that she had one key public health partner, the New York Academy of Medicine, which so happened to be one of the oldest public health institutions in the country. And so I want to take us back 10 years ago, and I think you all can recall that there was the Great Recession. And on this very day, in 2008, when Lehman Brothers crashed, the New York City decided to launch an initiative called Age-Friendly NYC. Oh, not sure what's going on with the slide here, but Age-Friendly NYC here we go. And the focus was on older adults. I think we've passed the slide. I'll just keep going. But the focus was to think about older people and how to plan for a city for them. She had a large percentage of older adults in her district, and the goal was to bring together various stakeholders in the community, various industries, and to get local government to start working together collaboratively. So the deputy mayor brought together all agencies, and people thought about how best to serve older adults, as well as the city council started gathering across all of its different committees what legislative actions they could take. And then East Harlem became the test bed because they had this great champion in Melissa Mark Viverito. And so there was great outcomes from this. First, they started consulting with older adults themselves. Older adults led to designing new bus shelters for East Harlem and thus the city. So 3,000 bus shelters were created utilizing funds from the U.S. Department of Transportation, and then the maintenance for those bus shelters pay for themselves through advertisements. They created a city bench program where residents can write into the local Department of Transportation and request a bench in their community, or business owner, anyone. A myriad of different initiatives spurred out of East Harlem. And it began the interworkings of local agencies working together, as well as collaboratives in the community beginning to work together. So that was 2007. They established an East Harlem age-friendly neighborhood in 2010. And all of that work then moved to the creation of consortium called the East Harlem Community Alliance, that is made up of over 100 nonprofits and businesses. And they came together to think about buying in East Harlem, serving East Harlem, hiring in East Harlem, and promoting East Harlem. And so all those businesses that the age-friendly initiative worked with then rolled up into this new initiative and then got connected to the Healthy Bodega initiative. And then the New York Academy of Medicine as the backbone organization, and with Melissa Mark-Viverito as the champion for the community, a lot of healthy procurement policies began to happen within small businesses and larger anchor institutions like a major hospital that's in the community. And then working towards local purchasing. And so a group purchasing organization came into the community and started working with those small businesses so that they could become part of the supply chain. And now, for example, Hot Bread Kitchen, which develops artisan breads in East Harlem, now provides their bread for hundreds of clinics and hospitals throughout the greater New York City region because they're now folded into this GPO. And as a result, Hot Bread Kitchen saw impact on their bottom line and a decrease in their overhead costs. So as we keep going, in 2014, and the slide you see before you is the East Harlem Healthy Neighborhood Initiative. So as the champion, Melissa Mark-Viverito continues to move along in her process and different initiatives come to the fold, she takes and connects each collaborative together so that you see this organic growth of different industries, different partners coming to work together for the overall health of East Harlem. And she's leveraging opportunities that are coming her way that have no money typically attached to it. And so this Healthy Neighborhood Initiative starts in 2014, and funding did come from the New York State Health Foundation. And their goals were to increase the availability of healthy foods and improve the built environment and link residents to programs that support lifestyle changes and to bolster economic opportunity. And at the same time, the mayor of New York City, new mayor of New York City, Bill de Blasio, unleashed his affordable housing plan, which meant that several neighborhoods throughout New York City were going to be rezoned. And one of those key neighborhoods was East Harlem. And at this point, Melissa, the champion, had become Speaker of the New York City Council. And she decided to change the way that the planning process was going to go. Typically in New York City, it is the city's planning department that leads the process. And she decided that she would be the lead, and she would establish a steering committee of 21 community stakeholders. And the focus for this plan was all about health and thinking about it through the various social determinants. And so we unveiled a participatory planning process in various domains. There was a whole health domain. We walked residents through the technicalities of affordable housing and helping them think through what the trade-offs would be. Where would you site new sanitation depots, the bus depots, lots of mapping, activities that I'm sure all in this call are familiar with, but it was really the community driving this process, and particularly older adults, because they had been at the table for several years at this point and really being the mouthpiece and spreading the word about the different things that were happening in East Harlem, and they were also invested. And so word of mouth marketing can be a way of doing communications. The other piece is that throughout each of these initiatives, the backbone organizations and others involved always reported their outcomes early and often. Small things add up, and it keeps people interested in the momentum going. And because she led such a process, there was an opportunity for change. And so the traditional process for rezonings is under consideration for a new process where communities define their needs first versus the city planning department coming after decisions are made. And this is an example of various partners working together. You can see on this wheel that some of these talk back to various social determinants of health. And then you've got, you know, the speaker's office involved. You have state elected officials involved. You have unions involved, schools involved, just a myriad, and businesses involved. And this is all from this outgrowth from 2007 at the start of this age-friendly initiative in this small neighborhood of East Harlem. And luckily, that money that came from the East Harlem Healthy Neighborhood Initiative decided that they would take part of that money, so it's $600,000, and allocated $275,000 for a neighborhood fund. And community residents decided how to allocate this money. So over 10 organizations received seed money in the amount of $25,000 to $50,000 for their programs. And it was the community as a whole that decided who would receive the money. And there was a small health and action panel that was selected from the community. So folks were able to apply, they were screened, and then they came up with the criteria of how organizations would be chosen. And all, of course, led by the champion, Melissa Mark Viverito. And then attached to the work for the rezoning, there was a companion health impact assessment. And so because of the success of the assessment, recommendations are calling for the implementation of HIA principles into the city's environmental quality review guidelines. And so that helps to start codifying some of these principles, and health impact assessments are a way of can be a way of driving equity, particularly the process in and of itself. And now the New York City Council is also considering introducing legislation to require health impact assessments for particular projects and for rezonings. So I want to talk a little more in depth about approaching sustainability with limited resources through two approaches: health in all policies, and then leveraging policy change as a tool to promote sustainability. So you heard Rachel and Sandra mention PSC change, which is key, and doesn't cost money, but does take a lot of elbow grease. So just a quick overview about health in all policies. It really, in a nutshell, is about bringing public agencies together. Let's face it, we all can't, it takes everyone at the table to really have successful initiatives that will promote healthy communities. You can't improve health or reduce health disparities without bringing everyone's insight and expertise together in service of a common goal. And so I know for us here at Change Lab Solutions, and many years in working with public health practitioners trying to reduce the incidence of chronic disease and health disparities, we've come to find that public health departments can't do it alone, and we explain why they can't do it alone. And they need planners like you to help make these improvements happen. You need transportation engineers to think about innovative ways to change the structure of roads. You need the school district to help you open schoolyards in the weekends. You need city council representatives to prioritize health and health equity. And just like public health departments need your insight and expertise to improve the health of your community, you're going to need everyone to be on board with you for your plan. And this is something that New York City took upon itself to take a health and all policies approach. And that's why many of its initiatives, including age-friendly, building healthy neighborhoods, have been able to sustain itself because they earmark their budgets in order to support that work, and also codify policies that that also come and wrap around. So there are basically 5 tenets of health and all policies. 1, you want to convene and collaborate. So that's talking to communities, that's convening your stakeholders, and really thinking about designing collaborations for people to work together and defining a common vision and goal. You want to engage and envision more. And then you make a plan. You make a collaborative plan. What agency is going to do what? Can money be reallocated or repurposed? Or can funding do double or triple duty? You want to also think about investing in change. So there's been some conversation about diversifying funding. Philanthropy can't do everything. Government can't pay for everything. So public-private partnerships become key here. If you know that you're going to be receiving money from the federal government or state government, I'm taking a local approach here, then you want to earmark it for opportunities that are going to promote health as well as, for example, advance economic development priorities. And then, most importantly, you want to track your progress. Having collective data, sharing those data sets amongst city agencies and with the community is also key. And then there's just plain old policy development, which is more than just legislation. We all think about, schoolhouse rocks and the bill that's sitting on Capitol Hill. And yes, that certainly is policy, but there is a broader definition. I find it easier to define policy through examples and through a dictionary style than through a dictionary style definition. We consider everything from local ordinances to contracts to be policies. The characteristics that these all have in common are that they are all written down, they establish rules or principles to be applied broadly, and not all policies are equal in terms of effectiveness or strength, but the clinical practice guidelines, it's all about more of the application and implementation of said policy and enforcement of it. So this gives you a greater depiction of different types of policies. You've got small p policy, big P policy, institutional policy, and you can derive to great change. So an example can be, like in East Harlem, the major health provider, Mount Sinai, changed its procurement policy so that small businesses within the community could also bid on contracts. Policies come in different forms, but most of all, they're binding, and they can be applied widely within whatever jurisdiction that they're passed. And there are some great benefits to it, namely that because they're binding, they allow for accountability and enforcement, which is key. And ultimately, policy can be a way of institutionalizing good ideas. And in the case of place-based projects, there's a way to institutionalize good projects and to see them go on in the out years. So I'm going to stop there because I know we have very limited time. Thank you so much, and I look forward to your questions.
Thank you so much, Shaniqua. That was an incredibly helpful overview. I really enjoyed hearing more about, the efforts in East Harlem, but then really sort of how you drew that to what we know is incredibly important, which is, the opportunity to embed and institutionalize this approach through policy and practice change, and also partnership. So a whole other new set of P's there, I think, that you covered. So folks, if there are questions or comments that you would like to bring out, please send those to APA, and we will make sure to cover that. One thing we just wanted to add to this conversation is that our focus, of course, was touching on different elements of sustainability, including the partnerships piece and policy, community engagement. But we recognize, of course, that, resources, funding to have the staff time to do that engagement and leadership building and be part of these partnerships are needed on one end. So we don't want to ignore that or say, it doesn't matter as much. It's part of this equation. I think it's important to note that, this has been brought up in many ways through public health field and planning, and folks are really thinking about innovative ways, models, and mechanisms to create more sustainable funding mechanisms in different ways. So we wanted to kind of backtrack a little bit, and so sorry, you're going to see a couple maybe of slides going through. And I don't know if we have the capacity to actually move backwards. You're going to see a little flash of some slides, but we're just going to give you some visual elements of a promising set of models and approaches.
So we wanted to share one or two ideas to spark some thinking. That's, I think, been one of the greatest opportunities through Planners for Health, is to talk about what is new and next in the healthy planning field. So with that in mind, we wanted to share a notion with you that we call closing the loop. So without going too deep into all the mechanics of the framework and all that, the idea here is basically that prevention work, which is another way of saying healthy planning work, saves lives, it saves money, and it reduces needless suffering and disease and injury. Those cost savings, that's families saving money, that's employers saving money, that's insurers saving money, that's our society saving money. As one example, a University of California at San Francisco study recently found that over about a 20-year period, the California State Tobacco Prevention and Control Program yielded a return on investment of $55 saved to every $1 spent. It's huge, huge savings. That's savings in medical costs, and it saved productivity and lives lost and all that. And so the idea of closing the loop is that we could capture those $55 saved and reinvest that into more prevention work that could go on to save additional lives and additional money and promote quality of life. I think another way of thinking about this is just that this is the way we do business. Again, this is the sustainability of the approach, but that we affix actual dollars and investment to that. One form that this model is taking that we're seeing around the country and even around the world is called a wellness trust. It can be called different things. Sometimes it's called a prevention and wellness trust, sometimes it's called a wellness fund, sometimes it's called a family wellness trust, lots of different names. But the idea is basically that it's a pool of funding that can support healthy community strategies, which are evidence-based and which have been shown to, again, save lives, reduce suffering, and save money. And revenue can come from a number of different sources. So we just quickly want to share a few examples just to jog your own thinking. Some of you may be familiar with what's been happening in the last few years in Mexico, where there is a 1 peso per liter tax, which is about a 10% tax on sugar sweetened beverages, and also an 8% tax on junk food. And the government is collecting these funds, pooling them, and then spending some of that money to ensure that every school in the country has access to clean drinking fountains. So again, it's not just gathering money, it's reinvesting it in health promoting investments. Here in California, where we're based, there is a program where when you purchase a car license plate, you can choose one from the Kids Plate program. So you spend a little bit of extra money, and that money is pooled, and it goes directly towards child injury prevention programs. Or in Massachusetts, they have the country's first statewide wellness trust. They charge a small assessment on health insurance companies and private hospitals, pool that money to invest in community-based strategies that will then lead to reduced need for those healthcare services over the long term. One final idea real quick is that in North Carolina, some of you may be familiar with the Tobacco Master Settlement Agreement funds that went out to a lot of states over the last few decades. North Carolina is investing their Master Settlement Agreement funds, which are about $5 billion over 25 years, in tobacco prevention and cessation programs and in community wellness. So again, it's the idea of capturing money from these sorts of sources, pooling it together, and investing back in what we know will keep people healthy in the first place. It's not just states and countries that are doing this. We're actually seeing cities and counties across the country establishing wellness trusts and raising funds from a variety of different sources. That can be a great way, as Shaniqua mentioned, public-private partnerships can contribute to that. It can be a really diverse array of funding that goes into it. We know, this may not have traction in every single jurisdiction across the country, but we did just want to share it sort of in the spirit of an idea of how to think about having those long-term, more reliable funding sources in the future.
Absolutely. Thank you, Rachel, for that brief overview. We'll send more information on that for folks who are interested. We have just a few minutes for a Q&A, and I'll invite Shaniqua back for just a moment. There was a question that emerged around, I think, in terms of sustainability, in the beginning and at the end of initiatives, particularly related to community engagement and leadership. For rezoning, are there ways in which you've seen community really be involved in rezoning opportunities on the front end rather than, oftentimes what can happen is rezoning permits and notices go out and people in community are sort of, oftentimes pushing back against something. And I think folks are wondering, Shaniqua, if you've seen any cases or examples in which community leaders are really involved in rezoning on the front end, maybe before some of the, permits and things are issued.
Yes. So I wish I had more time to go in more depth in this rezoning process in East Harlem, because it was exactly that. The council member recognized immediately once the mayor made the announcement that it was the community needed to be involved from the outset and needed to determine its own needs first before the Department of City Planning came in and executed its own plan. And so her idea of taking over the process and having city planning at the table, but that she was the driver with 21 different stakeholders in the community, and then each of those stakeholders were tasked with running large swath community visioning sessions. And so a good chunk of the neighborhood, which I should say is over 120,000 people, were at the table. And also she leveraged other mechanisms for input through the community board, which are meetings that happen monthly and of which many community members also attend. Because of the work in East Harlem, other neighborhoods within New York City pretty much adopted the same process. And because of this particular council member's status in the New York City Council as the speaker, what she did internally at the council was provided technical assistance, so had a whole team provide technical assistance directly to other council members about how to do this work. And she also leveraged the participatory budgeting process to have this align with the rezoning work. Yeah, I mean, I would say New York City their various neighborhoods have been setting the tone about, connecting with community first before engaging in the technical aspects of doing a rezoning.
That makes a lot of sense. That it's really a broader engagement and leadership opportunity there. I think coming from a question and just rolling off of the example that you gave, it sounds like this particular council member is very engaged, is really helping to lead these efforts. Are there any plans or thoughts from the partners involved on this, on really kind of how to pass the torch to future leaders in addition to this council person? Are there others that are kind of emerging to co-lead or really be part of the implementation process of this work?
Yes, absolutely. Because of the, there was a positive impact, and the city planning department recognized that it had allies in the steering committee. So now the steering committee has basically been formalized and is considered the East Harlem Plan Committee. And it was important to the city planning department that that group stayed intact through the process of developing the plan, ratifying the plan. So they will continue to be engaged. And I know at this point, the plan is due to pass toward the end of the year. That's the schedule. In terms of scaling up, what has happened is the Harvard Kennedy School of Government Innovation has recognized the speaker and the key parties, the steering committee that did the work. And so the best practices and learnings from that experience are being shared with other cities and local leaders around the country through the Kennedy School of Government.
That's great. Thanks, Shaniqua. We had a comment come in that mentions that through the Affordable Care Act, nonprofit hospitals are required to do community health needs assessments for investments of their hospital community benefit dollars. So the participant wanted to mention, just for any of the planners on the line, that this is something that's happening in terms of assessing existing conditions and then determining how hospital community benefit dollars might be spent. And actually one of the allowable uses for those dollars, which can be pretty significant in some places, are community conditions that do things like increase physical activity, increase access to healthy food, and so on and so forth. So in terms of building sustainability of partnerships and of funding, we would also encourage you to check out any hospital and healthcare partners to see what they're already doing in terms of community benefit projects and what more they might be interested in.
Rachel, can I touch on that really quickly to also say that in this project in East Harlem and some of the other neighborhoods, the hospitals are at the table and leveraging their community benefit dollars to invest in different projects the community would like to see around New York City, as well as there's a point to make about data in and of itself. And so the same type of data that hospitals, nonprofit hospitals, are collecting for their community health needs assessments often overlap with the same data that planners would be looking for to develop either a neighborhood plan or even a broader comprehensive plan.
That's great. Thanks for that, Shaniqua. Absolutely true. So we are going to transition to the next part of the session, but I did want to mention that APA will be posting a few of the materials we talked about on the Planners4Health website after the session, including, I think, some resources from Change Lab Solutions. They have excellent materials, so I do encourage you to follow up on those, and we'll send some of ours too. As we move towards the next part, we did just want to take a moment to reflect on the fact that, we're talking about sustainability, and the Planners4Health initiative has been relatively short-term. And that's something we heard from many of you that we met in New York at the NPC session. But we think it's been such an important infusion, both of resources, but also energy and attention for each of the different chapters, to have a moment in time here to really say, what is the status of our healthy planning network in our chapter, and where do we want to go next? Who else can we bring under this big tent? So it's been really an honor to participate in this. And as Shaniqua mentioned, with the Health in All Policies approach and many of our sustainability strategies, it's really important not just to be building partnerships between planning and public health, but also to look to sectors and partners and even professional associations beyond our own beloved APA and APHA. And that's what the call to action is all about. So we are going to hand it over to Anna and some other folks that we have on the line to hear more about what's next.
Thanks, Rachel, and thanks, Shaniqua and Sandra. Yes, exactly right. We are thinking about how can we, at the national level, also continue to sustain this work and support this work. And I really liked how Shaniqua talked about the multiple sectors that need to be involved in sustaining any community health effort, and the importance of diversifying the work, both for the importance of diversifying the work and diversifying the potential sources of funding that are used for organizing and implementation. And Shaniqua also talked about partnerships as helping provide these sources for providing data, defining the joint goals so that different organizations and different stakeholders and players are reaping benefits that help them in their individual sectors, but there's these common actions that can be used to do so, and so that everyone is bought in. So a few months ago, APA and all of these partners that are listed here, and it can become acronym alphabet soup, came together and talked about all of the work that we're doing individually as national organizations to promote public health and the built environment. The connection between our members was becoming more and more apparent. Obviously, through Plan4Health and Planners4Health, we've been able to support linkages between planners and public health professionals, but we've also seen a number of our coalitions involve members and professionals from these other sectors over the past 3 years, and know that people from these different sectors are really important for sustaining the work for all the reasons I just mentioned, and many more that you know even better than I do working at the local level. So I wanted to give an opportunity for our partners to talk about what they're doing so that it's not just me telling you that they're doing great work. They can actually highlight some examples of their work. But first, I wanted to pass it on to Kate Robb, who's a policy analyst with the Center for Public Health Policy at the American Public Health Association, who can talk about the different components of the joint call to action and give some more details. So Kate, you should have some control.
Great, thanks so much, Anna. And I just wanted to mention, because I didn't hear it mentioned, and I think this is quite impressive, that all the organizations who signed on to the joint call to action, combined, we can reach almost 450,000 individual members to really embrace this joint call to action. And if you just think about that, that's almost 500,000 members that we're reaching with this joint call to action. And we know, we've heard through this webinar already, how important collaboration is, how important it is to have many partners at the table to make sure that something's sustainable and you're really addressing health equity. So the joint call to action that we're going to be talking about today has 4 different pillars to it. And as you can see, the first pillar of the joint call to action is to build relationships, create and foster partnerships that advance health. And so under this pillar, we have 4 suggestions that our members could do, and I'll just read one suggestion from each theme. So this one I'll share with you is to engage with community members, form coalitions, and collaborate with organizations to understand health challenges and devise strategies to address them. And we've heard already how important that is. And Anna, I tried to click on the next slide, but it's not working to be perfect. Thank you so much. The next pillar we have of the joint call to action is to establish health goals, build an understanding of health data, and establish measurable health objectives for plans and projects. So one of the suggestions we have is to establish metrics for health and well-being concurrently with other project goals and measure health impacts and outcomes after projects are completed. Next slide. Great. The third pillar is to implement strategies to improve health, advance policies, programs, and systems that promote community health, well-being, and equity. So one suggestion here is to establish internal organizational policies that promote health within workforces, including worksite safety and workplace wellness programs. And then the last pillar that we have of the joint call to action is to share expertise, to really communicate the importance of health. So everyone on this webinar today knows how valuable our health is and how much we all have to work together in order to achieve health equity. So one strategy we have here is to really participate in and collaborate on public awareness and education campaigns to promote healthy communities, including campaigns related to sustainability and community resilience. Next slide. So I'll finish it up here, and we have a quote here from our ED, Dr. Benjamin, which you can read there, and it just shows how important this collaboration is. APHA, as I'm sure you're aware, champions the health of all people and all communities, and we try to be the nation's leading public health voice, and we have affiliates across the U.S., 54 affiliates, and we focus on working where we live, work, play, and pray, and working across sector to really strive for creating healthy communities for all. So thanks again for having me on here, and Anna, go ahead and take it away.
Thanks, Kate. So we also have, so obviously the American Public Health Association, their entire mission is focused on public health, but the missions of these other organizations are not necessarily fully focused around health, but we wanted to have staff from all of our partners, from a handful of our partners, talk about what their organization's vision is for healthy communities and how their members are currently engaged, and also how they see their organization's responsibility to contribute to the Plan Healthy Communities movement. Obviously, APA has been contributing over the past several years, particularly through the Plan4Health project, but we would like to see our APA members and our Plan4Health participants and Planners4Health participants begin to think more broadly about how they can also engage with these other sectors. So that's what we're going to learn about over the next few minutes. Our first presenter is Matt Welker, who is the Senior Manager for Strategic Alliances and Initiatives at the American Institute of Architects. And Matt, I'm passing the controls to you so that you can click through your slides.
Great, thanks Anna, and thanks everybody. I'm thrilled to be able to join you all and talk a little bit about some of AIA's activities and specifically as they complement APA and the other organizations as part of the joint call to action. A bit about AIA, most folks may be familiar, but we're about a 90,000 person membership organization based in Washington, D.C., primarily serving architects or aspiring architects, but also including international experts in design and construction and allied members from fields such as planning and construction, interiors, and others. We've been working at AIA on health in earnest for about 4 years now. And one of our primary messages, if I have control, excellent, is that health is not a typology. Really moving our membership along a journey that says we can look beyond healthcare to understand health in our communities, in our schools where we live, work, learn, and play, as others have mentioned. The initiative is inclusive of well-being and equity issues, and from the beginning, we set out at AIA to consider definitions across scales. So not only the building sector that we're usually pretty good at, but to try to be more inclusive and welcoming for perspectives from planning and from policy and other disciplines. It is part of AIA's larger strategic initiative around sustainability, which is on a 4-year horizon toward 2020. To help make what we mean by health and well-being make a little bit more sense to architects, we've focused our education, policy, tools, and resources around 6 approaches, including environmental quality, natural systems, access to nature, access to healthy and nutritious food, physical activity, safety, sensory environments, the sort of how we feel in a space as compared to the nuts and bolts and metrics of a space, and social connectedness, recognizing the importance of community, both in terms of the larger neighborhood sense, but also the people who comprise it. Highlighting a couple of AIA's sort of primary strengths that we've been working toward as we approach health and well-being in our work are by pushing on our communications. We've created a series of infographics and illustrations and other regular features on AIA.org. We've also published a series of reports that span the scale from very specific materials and microbiomes up to the community resilience scale, all of which address health and can be found on the website, AIA.org. We're continuing to develop more in 2018 and beyond. Similarly, we've worked to expand the traditional definition for architects, pursuing HSW and other continuing education criteria to be more inclusive of well-being and of equity. And we're launching an online curriculum later this year on AIAU, an online learning platform. For folks on the call, there are also some free courses that were underwritten by the Robert Wood Johnson Foundation that are available on the relationship of health and the built environment that are also available on AIAU and are free of charge to anybody who's interested. And lastly, through our industry leadership, really advancing some of our longer standing programs like our COTE Top 10 Award, the longest standing sustainability award at the Institute, which now includes health and well-being explicitly, to partnerships with universities and firms and local member groups in establishing a handful of community-based discussion forums where architects primarily, but others can come together to talk about the challenges they're facing and outline opportunities for improving it. And I think continuing and complementing a lot of the work that you all already do through the Planners4Health program. The map to the side highlights our university consortium. We currently work with 19 universities, schools of public health and either architecture or planning to advocate for new research and community-based projects that incorporate health, well-being, and equity objectives. We will be adding to that later this year and welcome you all to consider partnering with them or reaching out to them, especially where they overlap with your work regionally. One quote here from the University of Florida just talks about how it's been an invaluable ally in, similar to what we've talked about today, expanding the partnerships and identifying new sources to continue the work and build momentum, really ensuring sustainability for the organizations. Information on joining certainly is at aia.org/join, and I've listed my contact information, and welcome the opportunity to collaborate and work with more of you all as we move forward in our programs. Anna?
Yes, thanks, Matt. Really great overview of all the great work you're doing at the AIA, and wonderful to be partnering with you. Our next speaker is Shawn Balan from the American Society of Landscape Architects. Shawn is the Career Discovery and Diversity Manager and also a landscape architect himself, as well as being on staff at the organization. So Shawn, please go ahead.
Thanks, Anna. And once again, I would like to echo Matt's statement of thanks and excitement to be part of this effort. I've really enjoyed working with everyone on the joint call, and I'm really looking forward to moving forward with it. So first off, just a little bit about the American Society of Landscape Architects. We're a membership organization with about 15,000 members, including landscape architects with affiliate members, student members, and associate members as well. And we have 49 professional chapters throughout the country, as well as 72 student chapters. And one of the mission of ASLA is to lead the stewardship, planning, and design of our built and natural environment. So landscape architects, in a way, have always been designing for health, but not necessarily conscious of it. So this is definitely an exciting effort to be able to put those efforts forth to make sure that we're designing for the right reasons. So a couple things that's going on at ASLA. Recently, I like to say practice what you preach, but ASLA's headquarters, which is now the ASLA Center for Landscape Architecture, was recently renovated to showcase sustainable design excellence and healthy occupancy. So the headquarters was built in '95, so it's not considered a historic building, but In 2016, we renovated it to achieve LEED Platinum with a focus on maximizing energy efficiency, occupant comfort, and sustainable design. So this is just a little bit before and after. So you can see in the top right corner, we had the cubicles, very dark space. Since we're very narrow kind of building in Chinatown here in Washington, D.C., we had minimal light. So one of the big things was to open up the roof where we have our existing green roof and bring light down into the main atrium. So it definitely is a great space now, and the project integrates new construction into the existing space and footprint. And we're also pursuing WELL Silver certification for WELL building standard with a focus on improving indoor air quality, lighting, nourishment, and promoting active lifestyles. And such lifestyles is we do yoga here at ASLA, and we also do boot camp class during the week as well. So we're looking forward to using our building as the Center for Landscape Architecture, but also a Center for Health to show how, how a building, its elements of the building, and all of everything that happens as far as water collection on top to the side courtyard can all be incorporated into a healthy lifestyle. Also, one of the efforts that's been going on for many years is the Sustainable Sites Initiative. And sites, better known as sites, is a sustainability-focused framework toward practices that protect ecosystem and enhance the benefits provided to our communities, such as climate regulation, carbon storage, and flood mitigation. So I like to say, think of LEED, but for sustainable landscapes. And this was a collaborative interdisciplinary effort of the American Society of Landscape Architects, the Lady Bird Johnson Wildflower Center at the University of Texas at Austin, and as well as the United States Botanic Gardens. And it's now administered by the Green Building Certification, Inc. And also, some of the things that's going on within our ASLA's Government Affairs Advocate Network is a focus on federal and state legislation. And a lot of this is in support of healthy and sustainable solutions that landscape architects can provide to problems facing communities. And one of the things we do annually is have our members come to Washington, D.C. for Advocacy Day, where they have the opportunity to talk to their state representatives about the need for programs regarding green infrastructure, sustainable community design, safe and walkable transportation systems. And another thing that was developed earlier this year in anticipation of the incoming administration was a look at how we can prioritize and strengthen all forms of infrastructure and how landscape architects can work towards that and teach about bettering infrastructure and health systems. And some of these include fixing our nation's water management systems, upgrading to a multimodal transportation network, and designing for resiliency. So we have a few programs in hand, and we have a lot of resources as well on our website, and these are just a few of them. We have our Health Benefits Nature, which includes hundreds of free research studies, news articles, and case studies on long and short-term mental and physical health benefits. We have our Designing Our Future Sustainable Landscapes case studies, which includes about 40 case studies that illustrate the transformative effects of sustainable landscape design. And one of our latest things that was completed last summer was our Resilient Design Guide, which is organized around disruptive events such as drought, extreme heat, fire, flooding, landslides, and biodiversity loss. And these are all found on asla.org, and you have the links as well. And I'll echo a little again. Matt has talked about AIA's online learning platform, and that's definitely something that ASLA is working towards as well. As we have our existing online learning platform at learn.asla.org, and one of the things that we're working towards this year is creating a lot of our existing webinars that we have online to be free, and we'll definitely be focused on more of a health initiative as well as we continue forth with this joint call. So once again, I just want to thank you all for having me on the call, and I look forward to moving forward with the joint call.
Thanks, Shawn. It's so great that all of us have so many free resources available to share with one another. So if you're not talking, could you put yourself on mute, please? Just hearing an echo. Our last presenter is Rachel Banner, who is a program manager focusing on built environment and health at the National Recreation and Parks Association. And Rachel, I've given you control so you can pass through your slides.
Great, thanks, Anna. So I work at NRPA, as we like to call it. Our mission is to advance parks, recreation, and environmental conservation efforts that enhance the quality of life for all people. And we have about 60,000 park and recreation members across the United States, as well as 52 state affiliates. And our members are typically at their park and recreation agency. They may be working in out of school time for older adults. They may be park planners themselves. We do have quite a few planners who are in our membership, or our maintenance staff or our aquatics folks. So really a wide variety of people working in parks and recreation. There we go. And we typically focus our education and our professional development events on programming, policy, and environments that support our 3 pillars of health and wellness, conservation, and social equity. So as you can see, health and wellness is one of our only 3 pillars, and so it's a large part of what we do throughout our organization. And we really aim to reach people through physical activity and nutrition. And I specifically work on our built environment programs throughout our organization. And we do that through programs, specifically these here. So we have our Meet Me at the Park initiative, which is actually building playgrounds and increasing play across the United States in innovative ways. Safe Routes to Parks, really looking at the built environment and increasing access to parks. Commit to Health, which is focused on out of school time, healthy aging in parks. Our Wildlife Explorers program focused on connecting kids to nature. And as we know that connecting kids to nature also improves their health. We also focus on green infrastructure improvements to parks. So with each of these initiatives, we provide free webinars, free resources on our website that has materials on each of these and how to implement them in your community. And we also offer grants to communities to implement the strategies to achieve the goals of health and wellness through parks and recreation. Just wanted to highlight really quickly our conference, which is coming up in September. And I have listed probably only a quarter or less of the sessions here that focus on health and wellness at our conference. And they span a wide variety of topics from our 10-minute walk campaign, again, really focused on increasing walking access to parks and communities and the quality of parks and communities, to diverse voices, diverse needs. So how do you engage folks and strengthen your community engagement efforts, to tobacco-free policies in Tobacco County, speed sessions that include things like creating space to play, pocket parks, and others like reclaiming infrastructure, increasing access to public space for community health. So really a wide variety of sessions, all focused on increasing health. And then we also offer our traditional member benefits, so that gets you into conferences. We also have schools, so our manager schools, as well as certifications in aquatic facility operating, playground safety. We have online learning opportunities, and as I mentioned, most of our health initiatives offer free online learning opportunities, but there's also paid and member-only opportunities. We have our Career Center. And then we offer a chance for networking, and again, that networking has several health topics where folks can post on a discussion board and get answers from their peers. Advocacy support, so one of our big advocacy initiatives is health, and like the others have mentioned, we support transportation initiatives, initiatives that are increasing support for parks and green infrastructure, and also on out-of-school time programs, so increasing food access to those underserved in our community. And then we do also compile our knowledge base, so that includes research, our magazine, park metrics, and email newsletters, again, all of which have health very ingrained in each of those. Our park metrics, for example, looks at the health of communities and pulls reports from Esri and Esri business data to help recreation centers and parks understand their communities with a health lens. And we do research and surveys on our membership to understand how our local park and recreation agencies are engaging in health at a local level. And then we also offer, a part of our membership is actually industry suppliers. So that might be your bench folks, your playground equipment folks, and there are some member discounts on some of those supply type of items. So feel free to contact myself or Tiffany, who's in charge of managing our membership, if you have any questions.
Super, thank you, Rachel. What is so great about hearing about all these resources from all of you is that not only have you highlighted some things that are available to anyone for free, but also just knowing that your members, which Kate mentioned, 450,000 total across all 8 organizations, have these resources at their fingertips and go to your conferences and are really ready to partner on building healthy communities and working in coalition, as many of our collective members already are. So we're now transitioning to our last 15 minutes of Q&A, and this is certainly an opportunity to ask questions about the first part of the webinar, as well as this latter part from our partners in the built environment and public health fields. One partner asked about, participant asked about the free courses that Matt mentioned that AIA is offering, and so we're posting that link now to send so that all of you can find those free courses. We also had a question about new partners and if we're considering inviting other national organizations to partner with us on the call to action, and the short answer is yes. We started with this coalition of 8 organizations, but we are looking to include other national associations and other national organizations as partners so that we can reach even more professionals in different fields, such as transportation, for example. Medical doctors could be another option, as well as other organizations potentially like Change Lab Solutions as advisors and partners who can help provide technical assistance to our members across the country, and you already do, but having more folks be part of this formal network, we really do welcome. So yes, please send in any questions you have about sustainability and at the local level and as well as at the national level in this national effort. I will call your attention to the handout that we have posted that you can see on the right-hand side of your screen. You can download APA's sustainability checklist directly from the webinar right now. It's also available on our website, of course, but you can collect it here. So now I'd like to invite any of our panelists to give any thoughts or reactions as you have participated and listened to some of the comments from some of our partners. If Rachel and Sandra, do you have any thoughts on how some of these national organizations members can tap into our Planners for Health communities, since you know our grantees probably the best of any other people on this call?
Sure, thanks, and thanks everybody for sharing an overview of your work and your organization and how you're thinking about health. I wanted to just say from personal experience, having worked in Los Angeles for a number of years, that the American AIA, American Institute of Architects, representative in Los Angeles, was someone who turned out to a lot of meetings. This was a person who I felt like I was really impressed by his commitment, which demonstrated to me AIA's commitment to really show up both for coalition meetings and to give public testimony in terms of policies and networking and all that. So I offer that just as a way to say, I think not underestimating the value of just developing those personal relationships and thinking to invite architect colleagues, landscape design colleagues, healthcare colleagues, and so on and so forth, all of the different folks covered by the call to action. I think I've seen in my own work how powerful having those constituencies and those professions represented at the table, and for example, an architect to stand up and say, I'm a designer, I'm an architect, and I support health, that brings that other dimension, and it just, as we've been talking about, builds the sustainability of the healthy approach that much more. So I think that, that echoes many of the themes we've talked about before about building that collaboration and the partnership, but really not underestimating the value of those relationships.
Yeah, we completely agree. And certainly the lessons that we've seen from Plan4Health and Planners4Health emphasizes that. We've had another question come in about the role that arts and culture play in the health of cities and how we can increase the perception of value that artists and creative bring to the goals that we're sharing around healthy communities and healthy planning. And I'm wondering if, Matt Welker, you could begin an answer to that question, and then anyone else can jump in who might have some comments on increasing the visibility of art and creativity as it contributes to health.
Yeah, I think that's an interesting question, something that we struggle with. I think you see a lot in creative placemaking, and I've been really excited to see some philanthropic organizations, some organizations, and many nonprofit and local groups sort of considering what the relationship is between creative placemaking and health outcomes. There have been a couple in New York State that I've seen and been familiar with. Certainly Kresge has made some innovations. There's some in Minnesota as well that are looking at that relationship. And I believe it's Arts Place is also invested in sort of a long-term study to help clarify that relationship. Certainly from the architect's perspective, I think another way when you think about public art, which is perhaps not entirely the question here, but I think when we look at public art, it's a great intersection, I think, between planning, an opportunity for health, an opportunity for architects, and even folks with like the Parks Association, for example, right? If we're creating beautiful, stimulating places that encourage children to play and to interact, all of those start working toward a fun and joyful city. And I think we certainly see in some of our emerging literature that the quality of place matters, not only the quantity of place. But I'd welcome the other folks to weigh in as well.
Shaniqua, do you have any thoughts on this, or perhaps Rachel from the Parks and Rec perspective?
I did just want to. Oh, go ahead, Shaniqua. I'll follow you.
Yeah, I mean, I would agree with what Matt had to say. For me, the examples that I know most are also in New York State. Keeping with the theme of our conversation today, I can, in my presentation in East Harlem, that is one of the cultural, it's a cultural touch point for the city as a whole. And so arts and culture was thought of throughout this plan, and money was earmarked to support the cultural institutions. And just to give some context for those who may be on the line who are familiar with New York City, or those who have visited New York City, part of Museum Mile, like where the Metropolitan Museum of Art and the Guggenheim, all along Fifth Avenue, is a part of East Harlem, but also the community-based arts organizations. And then with respect to placemaking, Actually, the city's health department has teamed up with the Cultural Affairs department to really think through how to make that spread happen through other communities within New York City, and to train community residents in placemaking principles. And then lastly, the city's Department for Business Services oversees over 70 business improvement districts, and those are also the placemakers for New York City. So together, they all work together to really increase or fold in arts and culture into overall healthy communities and overall planning, specifically since it's such an economic engine for the city.
Great, thank you. Yeah, it's great to hear multiple perspectives on this. If no one else has any other comments on that question, I thought, in our last couple minutes here before we wrap up, we could talk about some of the next steps from the call to action, because it certainly is a broad call. We have these 4 pillars. We have some specific actions within them, but truly to make it actionable, we need to have a little bit more of a specific work plan. And I think I'm going to ask Shawn Balan from the American Society of Landscape Architects, who's been helping to lead a conversation with us among the partners, to jump off with a couple of the next steps that we think are going to help make it implement the call to action, particularly when it comes to engaging our local members.
Thanks, Anna. Yeah, I think one of the things that that we've been talking, now that the call to action press release went out in April, the next step was pretty much like, what now? How are we going to push this forward and keep going? So one of the things that we've been doing is trying to create a framework for the next 6 months to a year, so we can figure out exactly what are the tangible items that we can work with at both the national level and the local level. A couple of things that have been considered within the group. One of the things has been a shared calendar, both at really the national level and the local level, but just having the opportunity for local members to share, whether it's ASLA members, AIA, APA, so forth, to have a calendar in which they can share and not have events happening at the same time, or if there are events that are planned at the same time, maybe we can work together to create an event together, especially for the opportunity for continuing education credits and so forth. Another thing that's been considered in line with the shared calendar is more of a shared organization of contacts and local members as well, so that it's just a running list of people to reach out to that might be professionals in a specific area. And I think one of the biggest things that, it was kind of a no-brainer that's come up in discussion as well, that I encourage everyone on the call to really do. You can do it tomorrow if you wanted to, but one of the things that we discussed was just encouraging everyone to have a conversation with someone from a different profession about health. So the idea of, if you're a planner, you go talk to an architect or talk to a contractor or so forth about health and how it affects your work and how important it is to move forward with. So I think those are just a few of the things that we've started to talk about in building a framework as we move forward. But we definitely look forward to pushing it forth and making sure that we, the ball keeps rolling and we're successful in these efforts.
Does anyone else have any other next steps that we've talked about that they want to jump in with? I know that we, to kind of build upon the shared calendar idea, the idea of having collective events where we invite to one another's conferences. We make sure that health is one of the lead topics at our conferences, whether it be national or chapter level conferences. I think is going to be one of the best ways to get traction and keep the conversation alive. at APA, we're also building a network of members who are engaged with public health and healthy communities. Many of you are probably aware of it already if you've been part of our Plan4Health family over the past couple of years, but we're calling the interest group the Healthy Communities Collaborative, and it can involve members from the American Public Health Association and APA together, and certainly members of these other organizations are welcome to join as well. You don't have to be a member of APA to be part of it. And it's becoming an important place for continuing the conversation, both as a social support network for people, so you know you're not alone in working on this, and also to share ideas of lessons learned and challenges and resources, so that, like Shawn said, we know who we can call and if we need a speaker or we need ideas. And also to raise the profile of health within the organization. Having that interest group alive and active keeps it at the forefront and makes sure that our leadership at the national level and the state level continues to think about health as a primary goal for planning. So we've reached the 4:30 mark, and thanks to all of you who've stuck with us throughout this entire webinar. We've had a pretty active participants and really great set of speakers today. So I am going to now conclude our 6th webinar in this series for Planners4Health, and appreciate everyone who's followed us along over the past 6 months. And we couldn't do this without you. This is why we're here, is to promote healthy communities. And it was a great session. And we'll be sending out the recording as we always do. So have a great rest of your day. Enjoy the rest of your summer, everyone.